My name is Kenneth Kim. I'm an allergist and founder of the Allergy, Asthma, Respiratory Care Medical Center based in Long Beach and Costa Mesa, California. In way of my background, I completed my training at Harvard College and Harvard Medical School, and I entered the field of allergy because it was one of those fields where we could make a difference in the people's quality of life. For those people with allergy and asthma, there has been a slew of medications which our practice has helped develop over the last 20 years. We have also been at the cutting edge of developing new therapies that are convenient and cost-effective for patients. One of the innovative areas that I'd like to share with you is discussing sublingual immunotherapy, which is, although an old practice, has become more widely accepted with recent data. This is an important alternative way by which patients can actually choose to get desensitized to their allergies, treat their underlying problem, and not have the inconvenience of getting shots in their arms with local reactions and having to come to the office on a regular basis. I'd like to share this information on sublingual immunotherapy with you. Allergen immunotherapy is a treatment process by which one desensitizes an allergic patient to something that they're allergic to. There are two types of allergen immunotherapy: subcutaneous immunotherapy, or SCIT, or sublingual immunotherapy, also called as SLIT. Allergy immunotherapy was first described in a paper published in 1911 by Dr. Noon and Dr. Freeman, two British allergists. They showed that giving pollen desensitization shots actually dramatically reduced the patient's symptoms. Following their work in the 1920s and 1930s, continued clinical research continued to show the efficacy of doing allergy desensitization. The first paper describing sublingual immunotherapy was published in 1936 by Dr. Hansen from the Mayo Clinic. He studied dust mite immunotherapy using sublingual drops and was able to demonstrate that using sublingual drops under the tongue was the most effective place to place the allergen. This can be used to desensitize individuals who are allergic to allergens such as pollens, dust mite, mold. The use of medications such as antihistamines and nasal sprays actually treat the symptoms of allergies. Allergen immunotherapy, either sublingual, SLIT, or subcutaneous, SCIT, treat the underlying problem and is actually preventive. What immunotherapy is doing is actually inducing a tolerance to the allergens you're exposed to. Studies done in Europe in the 1980s continue to demonstrate the efficacy and safety of SLIT as compared to SCIT. In 1998, the World Health Organization concluded that SLIT was a, quote, viable, safe, and effective alternative to allergy shots, and that its use in clinical practice was justified. In Europe, 40% of all allergy desensitization is SLIT, not SCIT. However, in the United States, since the FDA has not approved SLIT, most treatment still remains SCIT, which is subcutaneous immunotherapy, or otherwise known as allergy shots. In my review of the medical literature, SLIT, sublingual immunotherapy, has comparable efficacy to subcutaneous immunotherapy, or SCIT. The advantages of SLIT, however, are not coming into the office, have more convenience, and avoid the local side effects of getting allergy shots. The FDA has approved the allergy extracts which are currently being used for subcutaneous immunotherapy. These same extracts are the extracts that are used to make sublingual immunotherapy drops. However, the FDA has not approved these extracts for oral use. Nonetheless, it is entirely within the jurisdiction of an allergist practice to use these allergen extracts for sublingual immunotherapy if they feel comfortable. This would be an example of off-label use, but off-label use is acceptable as long as an allergist feels that it is medically appropriate. The allergy drops are actually not a medication, but actually the allergen themselves. By placing the allergen into the drop, we're actually teaching the body to gradually tolerate the allergen and not develop an allergic response. There are two ways to determine what someone is allergic to. The first is blood tests. They're typically called RAST, R-A-S-T. The other way is actually by skin prick and intradermal skin testing. The latter is actually more sensitive and actually gives more accurate results. Once you've undergone allergy RAST testing or skin testing, our office can actually make up a mix of allergens that can be used for your sublingual immunotherapy dosing. Traditionally in the United States, the only treatment for desensitization involved SCIT, subcutaneous immunotherapy. With sublingual immunotherapy, this allows patients to actually administer the allergen at home. With subcutaneous immunotherapy, one has to actually live within a reasonable distance from the allergist's office, since SCIT requires coming into the office approximately twice a week during the buildup phase and then approximately weekly during the maintenance phase for a period of time. With SLIT, the patient can live from a distance and actually just come in periodically to be evaluated by our office. There are a number of immunologic mechanisms by which immunotherapy works. This desensitization is actually a way of retraining your immune response. What is actually happening is quite complex and involves both humoral immunity as well as antibody immunity as well as cellular immunity changes. Very simplistically, the way I like to explain things is allergen desensitization is actually inducing IgG antibodies, and I say this is G for good. Those who have allergies have IgE antibodies. E stands for evil. The level of Ig antibodies will ultimately decrease, whilst the level of IgG antibodies for that particular allergen will actually increase. When this occurs, then when someone is re-exposed to an allergen such as dust mite, the IgG antibodies will actually take this allergen that's been offending and causing symptoms for this patient and get rid of it through a different mechanism. This will then prevent the IgE antibody, which causes the allergen to trigger an allergic response, not to actually cause that response in the patient. This is a very simplistic explanation of the mechanism of how desensitization works. The benefits of sublingual immunotherapy as well as subcutaneous immunotherapy is that you're actually treating the underlying problem. Rather than continuing to use medications which actually treat the symptoms, we're actually trying to change the body's immune response as it reacts to the environment. There are multiple studies that have shown that allergen immunotherapy can actually reduce the cost of the medications, improve people's quality of life, and overall improve symptoms. Allergy immunotherapy in the long run is more cost-effective because of the long-term daily cost of very expensive allergy medication. In addition to the convenience of not having to live near an allergist's office to get subcutaneous immunotherapy injections, sublingual immunotherapy has turned out to be much more safe with a much lower risk of anaphylaxis. Because of this, it's actually deemed safe for patients to administer sublingual immunotherapy at home. The use of sublingual immunotherapy prevents patients from having to suffer from the discomfort of getting injections in their arm twice a week. Just like subcutaneous immunotherapy, sublingual immunotherapy takes approximately 6 to 9 months to take effect. There have been very few comparative studies comparing SLIT versus SCIT, but the overall consensus is the effectiveness is approximately the same. At the current time, insurance companies do not cover SLIT as it's still undergoing FDA approval. The greatest disadvantage of SLIT is it does require a cash outlay by the patient because it is not covered by insurance. Allergy drops are given once a day during buildup phase, which is approximately the first 4 to 5 months. Once the patient reaches a maintenance dose, the allergen immunotherapy is continued for approximately 4 to 5 years. theoretical risk for anaphylaxis or severe allergic reaction. However, to date, there has been no reported systemic reactions to SLIT. As stated earlier, although there are no fatalities that have been reported with SLIT, signs of anaphylaxis that one needs to be aware of include itchy eyes, watery eyes, itchy tongue, swelling of the tongue, hives, diffuse rash, shortness of breath, or wheezing. If you develop any of these symptoms, you should stop dosing with your sublingual immunotherapy and call our office. In addition, you should immediately take an antihistamine and have emergency epinephrine ready. If your symptoms become more severe, you should immediately call 911 so that emergency personnel can come and help with your symptoms. The bottles that we provide have a dropper mechanism, so you just place one drop under your tongue. Each drop has about 0.05 mLs, and once you place a drop, you hold it under your tongue for approximately 2 minutes. After the 2 minutes, you can swallow the drop, and then you can eat or drink afterwards. Alternatively, you can put the drops on a teaspoon and then have the drop put underneath your tongue. Again, wait for 2 minutes, and after that time, you can swallow the drop and you can then eat or drink. You should take the drops in the morning on a daily basis. I always recommend placing the allergen drops next to your toothbrush so that you brush your teeth and then you do your allergy drop. By associating this with an activity that you do all the time, you will be more compliant. There are 2 phases to sublingual immunotherapy. There's a buildup phase and a maintenance phase. During buildup phase, you will take 1 drop initially a day, and over a month period of time, you'll increase the number of drops. With each month, we'll increase your dose to a new bottle with an increased concentration, and again, increase the number of drops. When you get to maintenance phase, you'll be taking 4 drops on a daily basis. We typically like to see patients within the first 3 months and then every 6 to 12 months afterwards. This visit is usually done in the office, but for patients who are living far from our office, this can also be done with a Skype appointment or by phone. In the initial buildup phase, each buildup bottle will last approximately 28 days. During the maintenance phase, each bottle will last approximately 6 months. If you periodically miss a dose here or there is no need to worry and you just continue on dosing. If you miss more than a week, you will probably need to keep your dose stable. If you miss more than 2 weeks, I would advise calling our office for advice. Due to the glycerin additive that's added to the drops, there may be a slight sweet taste. However, most patients do not actually report any taste with the drops. During the buildup phase, you will receive new bottles at your visit. During the maintenance phase, you will actually be sending in requests and we will refill them by mail. The treatment vials all contain glycerin, which maintains stability. However, we would recommend keeping the vials refrigerated to maximize stability. It is okay, however, if you need to keep your vials at room temperature for a few days if that's necessary. There are no age restrictions for sublingual immunotherapy, and as with subcutaneous immunotherapy, we will start children around ages 4 or 5 when a child is able to communicate their symptoms to the parent effectively. Always check the vials to make sure you have the right vial the right dose, and that the vial has not been expired. In addition, you should make sure you know where you have antihistamine and epinephrine available just in case you have an allergic reaction. There are a couple scenarios where you should not be dosing your allergen immunotherapy using SLIT. If you are sick and have a fever greater than 99.5, you should not take the drops. If you're undergoing a dental procedure, you should avoid using the drops a few days before and a few days after the dental procedure. If you have asthma and you're monitoring your peak flows, if you're less than 70% of your baseline peak flow, you should hold taking the allergen drops. If you have asthma and you're feeling symptomatic with respect to your asthma, you should also hold taking your allergen immunotherapy drops. You should avoid taking the allergen drops if you are planning on exercising 1 hour after taking the drops, or you should avoid taking the drops if you've exercised 2 hours previous, as this can accelerate the absorption of the allergens. If you have any questions, you should always call our office regarding whether you should continue the allergen immunotherapy.